Okay, so just some definitions here. So ankylosis is a term that we use for fused or a fixed joint. So there's a condition called ankylosing spondylitis, which is a type of autoimmune disease of the vertebral column, where the vertebra slowly becomes fused and fixed. Okay, so just think of ankylosis as there's sets of joints that are just fusing and becoming immobile. Okay, muscle contractures. Well, muscle contractures are where there's been typically an injury or a stroke, and the muscle isn't being supplied by the nervous system anymore, and the muscles gradually contract, resulting in contractures. So that can leave someone with a very deformed arm or leg. If there's muscle shortening and contractures, um, they'll have improper positioning of the limb. Okay. Crepitus is just the sound that we can feel or sometimes hear with movements of a joint. Okay. Kyphosis. So if we think of a very, very old lady with a very kyphotic thoracic spine and she's bent over, so it's curvature of the thoracic spine, and typically it's from osteoporosis that's led to compression fractures of the thoracic vertebra, and the person is left kyphotic. Lordosis is typically in the lumbar spine, and it's just an exaggerated lumbar curvature. Okay, so if you were to feel your lumbar spine, you'd feel that the lumbar spine curves inwards. So if that was exaggerated, we could call that excessive lordosis. Okay. Myalgia, just a term for sore muscles. So it doesn't mean that the muscles are dying. It doesn't mean anything about them. It just means I have sore, tender muscles. Okay. Scoliosis is the abnormal curvature of a spine, typically S-shaped, and it's in the thoracic and lumbar spine. Okay. So how can we tell if someone has scoliosis? Well, we just get them to bend over and touch their toes, and we look at the thoracic and lumbar spine to see that it's perfectly straight. And in someone with scoliosis, it won't be perfectly straight when they're bending over, touching their toes. Okay, you'll see that the spine goes off center. Ataxia, it's just another term for an uncoordinated, unsteady gait. Okay, and it's typically caused by some kind of neurological injury, and that's typically in the cerebellum. Okay, so the cerebellum is responsible for coordinating motor movements, and when there's a stroke of the cerebellum, it often results in ataxia. Okay, I won't spend too much time on this slide since we just spoke about it. Kyphosis, which is excessive curvature of the thoracic spine. So I think of the older lady with compression fractures from osteoporosis, and she's really hunched over. Lordosis is that curvature of the lumbar spine. And then, of course, scoliosis. You can imagine when this person bends over to touch their toes, it'll be very clear that the vertebral column is not completely straight. Okay, so let's move on, and we're going to talk about some musculoskeletal injuries and different diseases of the musculoskeletal system. Okay, so when we're ever thinking about trauma or injury, it always comes back to what's called the primary survey. So if someone's in an accident or a trauma where they've fallen off a roof or out of a tree or a ladder, and they have multiple bony injuries or musculoskeletal injuries, yes, they're important, but they're not primary. They're not the most important. So other assessments take precedent. And it's always going to come back to A, B, C, D, E. Now, in real life, a lot of these are done together because there's more than one person, right? So there's often a team in a trauma situation. So it's not like we're fixed on A and then we go to B and then we go to C. No, typically someone is going to address the airway first. Okay, so airway and breathing are typically assessed together by one team member. So we'll go up to the patient, we'll ask them how they're doing. If they're able to talk to us, well, we know their airway is intact, right? If they have garbled speech and they're choking and they're not able to respond to our questions, well, we know that there's likely an airway concern, okay? When we're assessing someone's airway, typically we immobilize their cervical spine until we know there isn't a fracture. Because the cervical spine is so mobile, it's very prone to fractures and injuries. So we want to immobilize the cervical spine. Breathing, well, we can look at someone's chest to see that both sides of the chest are expanding normally. We can listen to the chest, listening for proper air sounds bilaterally. Circulation we can assess by the appearance of the patient. Are they confused? Are they conscious? What's their blood pressure? What's their heart rate? Does their skin look pale? Do they have normal capillary refill when we press on their nail bed of their fingers? Does the blood fill the area after we've compressed the tissue? Okay, so those are the primary ones: airway, breathing, circulation, always including C-spine precautions. Disability is doing a neurologic assessment. Okay, so once we're happy with A, B, and C, we do a neurologic assessment. That's what D stands for, disability. Are you able to move your arms and legs? Are you able to speak to me? Are you able to answer my questions? Or are you confused? Are you obtunded, lethargic? Have you had a head injury? So we want to assess disability because we're going to follow it over time if someone say has had a head injury or a spinal cord injury. And then finally, E for exposure and environmental control. So we want to expose all parts of the body so that we can do a proper assessment. And environmental control, meaning always think of the temperature of the room and also think of the environment that they have just come from. Were they lying in a ditch in the wintertime? Are they hypothermic? So we need to think of all of these things when they come in. Do they need blankets? Do they need rewarming? Okay. So if any one of these parts of the primary survey become abnormal, well, then we just go back, right? So if something happens to the airway, we just go back and do another assessment. We start with A. And these are very quick assessments, right? So A, B, C, D, E can take just minutes. So we can continually do primary surveys if we're not happy with it. And we typically try not to go from A to D. We typically try to keep them in order. But just reminding you that if there's 3 or 4 team members, often different team members will have a particular role. So airway and breathing might be one person, circulation would be another person, disability and exposure would be another person. Okay, so I don't want you to think that it takes half an hour to do a primary survey. These are really quick assessments. Okay, so when we're thinking of trauma, the best treatment is prevention, right? So, and in particular, when we're thinking of elderly people, a lot of elderly people are on blood thinners, right? So falls in elderly are extremely common, and now that we have so many elderly people on blood thinners, well, that's a trauma. So the fall is significant in an old person, and now the blood thinner is going to make whatever's been injured bleed significantly. Okay, so in terms of home safety, taking away slippery rugs, uh, making sure that they have proper footwear for the flooring that they have, canes and walkers for them to use. Really important because when an older patient falls, they invariably injure or break a bone. Okay, and then that puts them in a potential downward sequence of wrist, hip fractures, leading to immobility, leading to bed sores and DVTs and muscle weakness and muscle atrophy, and it can sometimes be a downward spiral. Okay, and this was someone who was living at home and doing quite well. Regular exercise in the elderly is really important because that's what maintains strong muscles and also the flexibility of their joints. Okay, and that's going to contribute to their balance to make sure that they're not unstable on their feet. Advising elderly patients to stand up slowly. A lot of these patients are on antihypertensive medications. If they get up too quickly, they get dizzy. And when they get dizzy, due to low blood pressure, they go down, right? And if you're 5.5 feet tall, that's a pretty, and you hit your head, that's a pretty good distance to hit your head when you're older. Those patients can have a lot of different types of skull and brain injuries, okay? And lastly, in elderly, they are often on an assortment of medications. I mentioned antihypertensive medications, but they're often on antidepressants, sedating medications for sleeping, drugs that have anticholinergic side effects. So when I say anticholinergic, that's dry mouth, dilated pupils, confusion, constipation, orthostatic hypotension, inability to urinate. So when you hear anticholinergic, think of those side effects. Okay? Okay, so soft tissue damage. So when we think of strains, we're typically thinking of the muscle tendon unit. Okay, so for example, in your lower back, so your lower back muscles attach to your lower back bones, such as the posterior pelvis, with tendons, right? So strains, so muscular strains or tendon strains, we use that term. And we can use it for a calf muscle strain, a hamstring strain. And if the strain or if the force is great enough, well, you can actually either tear through the muscle and have a muscle, a significant muscle tear, or you could actually just tear off the muscle, the tendon completely. And that's a tendon rupture, right? So, and some of those need to be reattached. So, for example, someone who lifts a really heavy weight and they tear off their biceps tendon, okay? Some of those need to be reattached, especially in a younger person, okay? A sprain is typically overstretched ligaments, and they can be very mild, right? So you had a bit of a misstep as you were walking, and you just went over on your ankle very mildly. You stretched the ligaments, so you had a mild ankle sprain, and all the way to a very severe sprain, where you completely went over on your ankle. You tore all the ligaments on one side of your ankle, and now you have an unstable ankle joint, okay? Because it's the ligaments that provide stability to a joint, or it's the ligaments that attach from bone to bone and give a lot of joint stability. Now, there's also muscles and tendons that come over joints and also give joint stability. But because ligaments are going from bone to bone, they're giving a lot of strength to joints. Okay, so this is showing you what can happen with a very forceful strain. So this is the ankle joint, and at the back you can see this loose piece of bone. Well, the Achilles tendon actually attaches to that, and in this particular situation, um, where there was an injury that put a lot of force through the Achilles tendon, well, instead of the Achilles tendon ripping off, it took a piece of bone instead. Okay? So the Achilles tendon could have completely torn, and we wouldn't see any bony injury on the x-ray. We would know that the Achilles tendon is torn because they wouldn't be able to walk, since you need your Achilles tendon to lift your ankle, right? So you wouldn't be able to lift your ankle, and that's going to prevent you from walking properly. But in this case, a little piece of bone came off instead that's attached to the Achilles tendon. So this is actually a better scenario than ripping off your Achilles tendon. And why is that? That piece of bone can be reattached to the back of the calcaneus bone there. And as we know, bones heal much better than tendons or ligaments. Okay? So I would take this injury over a torn Achilles tendon, because I know that piece of bone is going to reattach more quickly and have a lot of strength, instead of depending on the tendon to try and heal, which takes much, much more time, and it doesn't tend to heal as strongly. I didn't mention on the previous slide that when a tendon pulls really forcefully on a bone, and it takes the bone off instead of tearing the tendon, that's called an avulsion fracture. Okay, so the bone has avulsed off of itself, and the tendon has taken a little chunk with it. Okay, and avulsion fractures can happen with ligaments too. So when a ligament gets stretched, say for example, as your ankle joint is going over, instead of the ligament tearing, it can take a little piece of bone with it called an avulsion fracture. Okay. So I won't spend too much time on this slide, because these are just signs and symptoms of soft tissue injury and inflammation. So the edema, the pain, the reduced function, redness, bruising. I don't see warmth there, but often it's warm. Okay, so all signs of inflammation. Okay, so what do we do for soft tissue damage, typically in the first 48 hours? Well, we can apply what's called RICE. So resting, application of ice because of the inflammation, compression dressings, elevation of the affected limb, and as well, um, not that it's in the mnemonic here, NSAIDs, non-steroidal anti-inflammatories, to try and reduce the inflammation. Okay, we don't typically continue this for weeks and weeks. It's usually just in the first couple of days, okay, where we're going to advise someone with a soft tissue injury not to overuse the limb, to apply ice for 15-20 minutes, 4, 5, 6 times a day, put some compression to minimize the edema, and of course elevation to also minimize the edema. Okay, so soft tissue injuries still. So a contusion is really another term for a bruise, right? So if you have a brain contusion, well, you have a bruise on your brain. If you have a contusion on your arm, well, you've got a bruised area on your arm, okay? Ecchymosis is an area of bleeding into the tissue. So because of the injury, blood vessels ruptured underneath the skin, and they led to an area of ecchymosis. Now, what's the difference between that and a hematoma? Well, a hematoma is a collection of blood under the injured area. So say, for example, you fall really hard, you hit the back of your head, and now you notice this big goose egg on the back of your head. Well, that's probably a hematoma. It's a collection of blood, okay? And sometimes, if someone has a significant hematoma on their body that's making them very uncomfortable, we'll just open it up and drain it, okay? So on the left here, in this image, that's ecchymosis. That's just all bleeding into the tissue. There's nothing to do for that, except we usually tell people, by the way, that blood that's in the tissue there, because of gravity, it's going to gradually track down to your ankle, okay? Now, on the right, a hematoma under a fingernail. Well, if anyone's ever had one of these, they're really uncomfortable because of the pressure. So this hematoma under the nail, it just constantly throbbing and under pressure. So we typically put a heated needle into the hematoma, through the nail, and drain the hematoma. Okay. If we're talking about a hematoma on a part of the body, say you landed on your leg, and you fell and landed really hard on your leg, and you have a large hematoma on your thigh, typically we'll just tell people, listen, it'll get reabsorbed slowly by the body, but if it's really uncomfortable and painful, and we can see that it would be easy to drain it and then wrap it in a compression gauze, sometimes we can do that just to drain the hematoma. Okay, so ecchymosis and hematomas are different.